So greetings, friends and followers. This is Nurses Talking. I am Del Barzi. As always, if you like what you see and hear, subscribe, leave us a comment, and let us know what you think. Here on Nurses, we speak to nurses anywhere in the world and at any stage in their nursing career. Today, it is my very great pleasure to welcome Olanrewaju Adeyinka, better known as Nurse Kate. Nurse Kate is a registered nurse. She's a content creator. She's a founder and convener of Heart Health Awareness. She's a producer of Heart Health Magazine. She's an author of 2 books. And she says she's determined to continue to empower individuals to take charge of their heart health. So, welcome, Kate.
Thank you so much, Ma.
Thank you for doing this. Thank you for doing this. So firstly, what brought you into nursing?
That's that's a wonderful question. As much as I can remember, I guess I just want to do something different from my parents. I was raised by teachers. My dad, my mom were both teachers. So I just want to do something new. I want to look into health. And I was fortunate, for my dad to accept. And another thing is the way nurses look, we have this perception about nurses that they are very neat, they are knowledgeable, and they are well respected in the community. So I think that's what really brought me more into nursing.
And you said, and that's interesting that you say you wanted to do something different from your parents, and you're a nurse, but most of what you do is teach. So you said something interesting. You were fortunate that that your dad accepted. Was he very influential in your choice of career path?
As the first child in my family, and our parents, always, African parents always wanted to do something more, become a lawyer, a doctor, something, to them. And so me coming, like, no, dad, I want to become a nurse. I choose to do this. The man was a bit, nursing. Do you think nursing is okay? Okay, then, no problem. Let's go for it. And he supported. Some parents will not support their child, for some aspects of their career, but the man did, supported me, and that's who makes me who I am today.
Okay, that's awesome. Support is there's no price that you can put on support. There's no price you can put on it. So was it challenging for you though? What are the challenges, if any, that you faced becoming a nurse?
I actually did have so much challenges. Just that the nature of our education here in Africa, like I said, I was brought up with a family of teachers that were a family of teachers, and so they value education. So I really don't. As far as I'm doing my best, I'm progressing. I'm taking each step. They were supporting, like I said. So I really don't have much talent. And the school, I attended a school of nursing, and everything was perfect. We had what is necessary for us, to become a nurse. So I don't really have much talent personally as an individual. The education was, smooth. The support was there, and I graduated when I'm ready to graduate. So I didn't really see much challenge. I really enjoy nursing as a person.
Okay. That's great. What made you choose cardiothoracic nursing though?
Wow, that's a nice question. I remember choosing cardiothoracic 7 years ago. I got my first official job in a kidney center. So I got to meet a lot of people with cardiorenal cases. So we take care of kidney patients in conjunction with heart issues. So, and there's no much, I got to know that there's no much awareness, more information about these heart health challenges. So when I got the opportunity to go for the course, I went for it, and and actually saw the flexibility of the specialty, because I can work in different areas. So, I can work in cardiac unit, I can work in cardiac intensive care unit, and I can actually work in any other cardiothoracic clinic. There is a
Yeah.
bit where I can educate, I can be in public, heights to educate them. There is this a bit flexibility. It's not narrowed to
Yeah.
bedside. So I was able to I can move from one part of the cardio to another part. So that is surgical or the medical part of it, and the adults and also the geriatric part of the cardio. So it's really a very interesting specialty.
Yeah, 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 yeah. Yeah, it's interesting to me that you put so much emphasis on taking care of your heart. Because it's inside. We don't see it. And very often, as humans, if we don't see something, it's very hard to focus on it. And your heart just works without you telling it to do anything. It's very hard to focus on it and say, oh, I need to do this to take care of my heart, or I need not to do this in order to take care of my heart. So it's huge. That's huge. As a nurse in Nigeria, what would you like to see change?
Um, I think I'll put my 10 years of age into nursing profession, so I can say little thing, about both from the clinical aspect of it and the education part of it. I guess I will still need a change in the aspect where we embrace the younger nurses. There's still a lot of gap, such as bullying, such as
Mm,
not really paying attention to the younger one, just expecting so much from them. Forgetting that we also gather the experience. You know, the experience is not just something you can pick. It's something you have to be doing and doing. The more you face the challenges, the more you overcome them, and that's why you accumulate it. So I will still love to see um, our retired nurses, more into embracing us, preparing us ahead, and those also in the service, the elder ones, embracing the younger ones. So there will be no much gap in between us or causing bullies or hatred, But so much has been happening in Nigerian nursing right now. There's so much advancement in the education aspect, in the clinical aspect, despite that we are short staffed, it's so much stress on the short staffing because of immigration process. So it's a bit attic. However, I will still want us to be, embrace one another as one generation is going, to be living a legacy of love, to the younger ones.
you are a content creator. So
Yes, ma'am.
how do you see technology, for example? How do you see us embracing technology within the healthcare field, or at least specifically within nursing?
Yeah. Technology has really brought so much innovation, most especially in our appearance as a nurse to the public. Nurses are very busy. We are occupied. We don't even have time to tell the public this is what we do. Some don't even know what we do as a nurse. They just believe, most especially in Africa, and in Nigeria in particularly, they believe that anybody that wears a white, is a nurse. Anybody that works in the hospital, whether you're a cleaner or you are an attendant, they don't care. As far you're a female, you work in the hospital, you are a nurse. So there is this bad image, there is this wrong perception people have about nurses. Okay, and another thing the Nigerian nurses is actually facing is what we call quackery. People who are not trained to be a nurse, working as a nurse outside, portraying themselves as nurse and mismanaging people. Okay, but this innovation, this technology, this content creating has really helped us to voice out, to show the world who we are as a nurse, what we do, what our strength, our skills, our knowledge. Some don't even know that nurses study so much to become, to have a PhD.
Right.
A lot believe that, oh, school of nursing, what does she know? What does she know? They rather respect a doctor than respecting you. But
Yeah.
now, because of because of the global world, because of the internet, because of the innovation technology, that like this show that we can communicate, other people can watch at every part of the world,
Yeah.
who we have, we are showcasing ourselves, we are coming out, we are speaking out. With a room that allow us to bring our voice, so that people know she's a nurse, a well-registered one. This one, no, she's educated. Go and read this, knowledgeable. So it has really helped us and give us a new look as a nurse.
Yes, absolutely, absolutely. And for so long, we have actually needed that. We have needed that. We've needed a platform where we can put ourselves forward and not just work. So, um, you you said you've been a nurse for 10 years. What that tells me is that you have many more years of this. You have many more years of this. But in those 10 years, what I see is that you've done a lot.
Every stage of me as a nurse, I really appreciate it. Touching lives. I've been able to work in an environment whereby I was able to touch life. I see people recovering. I see people appreciating me. And not just that. Recently, when I became more of internet, um, educating people, creating, health awareness, I now have more, powers. Like, wow, so nurse can be more than this. Having a lot of people appreciating my efforts, people seeing me doing something for them through my education, through my skills, my career. It gives me so much joy that I could be this valuable to my environment, to people around me, to the world. Yeah, you have people following me from different parts of the world, send me message appreciating my effort. And I think that's what I'm enjoying most in nursing right now.
Awesome, awesome, awesome. What if what advice would you give to someone though who wants to be a nurse now? What would you tell them?
Okay. Okay. I wrote my book this year, I think, and published it on the September 29. And what all talked about is a nurse and more. So, and like what he said, I was able to educate in that book. I was able to educate people who are coming into nursing. Okay, like you said, people don't have much knowledge about who a nurse is, because perception, because the parents don't want their child to become a nurse because you'll be narrow. You always work in hospital. You won't be able to be this, but you can be a nurse and a lawyer. You can be a nurse and an author. You can be a nurse and more. Okay, so anybody that wants to choose nursing right now, I would say is the best profession anybody can look into, especially young girls. You are not going to enjoy nursing alone. Your parents will enjoy it. You'll be able to take care of them. You have knowledge of, old age sicknesses, old age illness, how you can prevent it for them. Okay, you'll be so valuable for yourself, for your spouse, for your children, and for the community and the world at large. So it's a very beautiful profession. It's a profession that has so many benefits, and you cannot just stay in the hospital. You can be a nurse and be in the boardroom. So prepare yourself for that.
Yes, prepare yourself for that. Prepare yourself for that. So you just mentioned, first of all, you produce this magazine, right? What is it called? Heart Health Magazine.
Yes.
Awesome.
What actually prompted me to do that was there was a day I was coming back from work. I met a patient. I met a catcher man on my street, and the man was saying, "Please, I heard that you're a nurse." I said, "Yes." He said I had a headache that has been lasting for almost 3 days now. I cannot see clearly. It was giving me signs of hypertension. So I just took my time. So, okay, so let me just check your blood pressure to confirm. So I checked the blood pressure, and it was extremely high, and the type of medication this man has been taking was wrong. Despite having headache, he was getting some complicated analgesic that will not help the blood pressure, and I can smell stroke coming for this man. So I took my time to educate So the thought now came to me that what if I have a small magazine in a simplified way that people will be able to understand the symptoms of high blood pressure, that people will be able to know how to prevent high blood pressure, what to eat, what to know the numbers. Some don't even know the normal value of your blood pressure. Some have not even checked it before. They don't even have the knowledge. Talk of prevention. They just believe that we know that there's hypertension, but they don't really have the information. So I don't want to make it complicated, checking it on Google. So I have to simplify them in a simple way that a non-medical person will be able to digest it. And that's how the success of the magazine came in. And the people that were following at that time, the members of the Art Health supported, and that's how we published the first magazine and the second one as well.
All right, all right. And so you mentioned your first book in Nurse and More, but you also wrote another book, Living Well with Hypertension. So is that an extension of the magazine?
Yes, you got it, ma. Extension of the magazine. So I can remember that some people still need more information. You know, living with hypertension. The truth that hypertension has come to stay because of the old age, because of comorbidity. But how can you now continue living with it elderly? How can you? They don't even know the side effects of the medication. Some are not compliant to their medication because of the symptoms, the one that are expected, and the one they need to report to their doctors. And I observed that their doctors don't really explain much about the drugs apart from prescribing it for them. So, and that's what brought in the living well with hypertension, for them to know which side effects they need to accept and the one they need to report, the diet they need to abstain from, and that's how the book comes to stay.
Awesome, awesome, awesome. I see all sorts of big things in your future. Look at this, 10 years, and look at all that you have done. If you had to describe what you see as the most essential quality of a nurse in just one word, what would that word be?
I would say compassionate. Compassionate. A nurse cannot be separated from compassion, because it's when you are compassionate, you'll be able to understand your patient's feeling. You'll be able to understand their pain, you'll be able to understand their emotion, and you'll be able to go extra mile to bring them comfort. Because the greatest thing every nurse gives to a patient is comfort. The emotional comfort or the physical comfort, whatever the comfort you are giving, it has to come from the compassionate part of you.
Okay, okay. That word comes up a lot, and we recognize, I think we recognize that we need to have it. We recognize that that's part of who we are. That's an innate and integral part of who we are. One of the things, though, that we talk about a lot with nursing is that because of what we are, who we are, and because of our tendency to give so much, we often tend to neglect ourselves. So what does self-care mean to you?
Self-care means that I am also a human being. I'm also in need of every care I give out there. So, and that means my emotional, my financial, my look, because if I am not healthy, I will not be able to render the care. If I am not financially buoyant, I might not be really happy. If I am not mentally strong, I might misbehave. So as much as I'm giving to others, I should be able to give myself. So self-care means you deserve the care you give to people, the money you give to people, the effort you give to people. You also need it to give more to the society. So I would say self-care means you take care of yourself, you pay attention to your own body. Some nurses don't even check their own blood pressure. They don't even check their sugar level. They don't even go for health check. We overlook so many. You see nurses with cannula going to work, just because they want to be there. But forgetting we are also human beings, we can break down, and that is not good enough. So we should also pay attention to what we eat, to our own emotional need, and also to our own financial needs, so that we'll be happy doing what we do every day.
Absolutely, absolutely. Kate, before we go,
Wow.
is there any last word you'd like to leave us with?
Yes. Thank you so much for having me once again. To every nurses out there, you are all doing a great job. You are a hero. You are doing so much, and I'm loving the love we are giving one another right now in the world. You know, nurses now, I can say we are one of the most immigrant people in the world. Nurses move from Canada to US to Africa. You know, we are moving. We are connected. We're in a connected world. So thank you all for this wonderful job you do. Thank you for staying there. Thank you for hanging on. Thank you for mentoring us. Thank you for loving us. And thank you for putting so much in the world. I love you all.
Go right back to you, honey, right back at you. Thank you.
Thank you for having me.